Thank you all so much for joining us today. We're really looking forward to sharing a little bit more about the Mass Health renewal process. If you can flip to the next slide. What we'll really walk through today is make sure that folks understand what a renewal is, discuss why they're particularly important this year, share how you can prepare for the renewal that you will get this upcoming year, share actions that you need to take once you get that renewal, outline resources that are available to support you through this process, and talk through coverage options for the Health Connector if needed as well. So starting off, when we say a Mass Health renewal, what we're really talking about is an annual process by which we are required federally to check whether a member of MassHealth is still eligible for MassHealth. You might hear this referred to as an eligibility check, a renewal, an annual review, or a redetermination. And these renewals must occur every year for all members of MassHealth. When it's time for a member's coverage to be renewed, these renewals occur at the household level, and the head of household, which is somebody who has been defined in their application. So often like the first person who is listed on their MassHealth application originally, that head of household will receive the renewal form that needs to be completed for that full household. Whenever possible, we try to automatically renew a member, which would mean that we would take the data we have on file and try to match it against federal and state data sources. If we're able to confirm automatically that you are still eligible, then you won't need to take any further action. However, we're often not able to automatically confirm someone's eligible. And in those scenarios, what we have to do is we have to send members a renewal form in a blue envelope, which will collect that new information we need to determine whether or not they are eligible. Flip to the next slide, thank you. So while this is an annual process, we're really putting a lot of focus on the renewals this year. And that is because since the COVID-19 emergency starting in March 2020, we have been protecting an individual's coverage if they are on MassHealth. So what this means is while we've been trying to renew you the last couple of years, if you didn't reply or if your eligibility changed, nothing actually happened to your coverage. But starting this past April 1st, this changed. So now we are returning to our normal eligibility processes, and we need to renew all members to make sure they are still eligible for MassHealth. This will take place over the next 12 months, so from April 2023 through April 2024. And at any point in that time frame, you will get a renewal form in the mail. And what this really means is you need to keep an eye out for that renewal form and respond to make sure you're able to keep coverage. And as I mentioned earlier, whenever possible, we will try to automatically process someone's renewal, meaning that they don't need to take action. We'll just send them a notice saying that their coverage has been renewed. This often happens for individuals who receive SSI through Social Security because you're 65 years or older and you have a limited income or resources available to you. Or if you receive SSI through the Social Security Administration because you are an individual with disabilities and have limited income or resources. Or you receive temporary assistance of needing families through the Department of Transitional Assistance. Or you're currently or were formerly in the custody of the Department of Children and Families. Or you're currently a child or youth in custody in the Department of Youth Services. So those individuals may just be able to be automatically renewed, meaning we won't need them to take any action. But it's still true that if you receive a blue envelope in the mail, you need to reply to that renewal form. So what can you do now to prepare for renewals? We know that that renewal form will be coming to you at some point in the next 12 months, but you can take action now to make sure you're prepared for when that happens. Most importantly, you can update your contact information, making sure that MassHealth has your most up-to-date address, phone number, and email, so we're able to let you know when it's time to renew. You can also report any household changes that may have occurred, such as a new job, a change to your income, disability status, or pregnancy. And you really need to make sure that you read all mail that could be from MassHealth. So while this blue envelope will have your renewal form and is most important, there are other important notices that will be mailed to you. And it's really important to make sure you're still reading that mail from MassHealth. So there are different ways to update your information. Members who are 65 years old, members who are younger than 65 years old can update their information online through their MA login account. They can also do so by calling MassHealth customer service, or you can get help from a certified application counselor, a CAC, or a navigator. And you can find those CACs or navigators at the link on the screen. Members who are over 65 residing in the community, or individuals of any age who receive nursing facility care or in home and community-based waivers, these individuals can update their information by calling the MassHealth customer service or getting help from a CAC or navigator as well. This is that blue envelope that I mentioned that I also held up here. It's really important to make sure that you are watching for that in the mail. And that you've given us the best mailing address to send it to as well. Once you receive that blue envelope and you're ready to complete your renewal, there are different ways that you can do this. If you are under 65 years old, you can complete your renewal online through your MA login account at the link that Erin just dropped into the chat. You can also complete your application on paper and mail it back at the address on the screen. You can call the MassHealth Customer Service Center and complete your application over the phone, or you can schedule an appointment with a MassHealth representative. And you can schedule that appointment online at the link on the screen, or you can schedule it by calling the contact center as well. Members who are 65 years or older, or who are of any age and receive nursing facility care or in a home or community-based waivers, also have 4 different ways that they can complete their renewal. If your notice has an e-submission number, which will be shown on the form itself, you can submit your renewal online through a document upload or by a fillable form at the address on the screen. You can also complete your application in paper and mail it back to MassHealth. You can call the MassHealth customer service to complete your application over the phone, or you can also schedule an appointment with a MassHealth representative by using the online scheduling tool or by calling the contact center. When you've received your renewal, you will have 45 days to respond and send it back to MassHealth. That's really important to remember, because if you miss that deadline, you may lose coverage. And in that 45-day period, there are a number of resources that can help you if you have any questions or concerns about your renewal form. We have MassHealth enrollment centers in different locations across the state, and you can walk in to get help in person, or you can schedule an appointment for a phone or virtual call as well. There are 6 MassHealth enrollment centers across the state, and you can find a list of those at the link on the screen. There are also certified application counselors, what we call CACs, or navigators that are available to help you. And these are community-based individuals who are there and have been trained by MassHealth to really be able to answer your questions, help you complete your application, and make sure you understand the step-by-step process needed to maintain your MassHealth coverage or receive the best health benefit that you qualify for. Help from CACs or navigators is free, but you may need to schedule an appointment. The MassHealth customer service is also a great resource. They can answer your questions, they can help you find a resource, or they can just help you complete your renewal right there over the phone. The MassHealth Customer Service Center is open Monday through Friday, 8 a.m. to 5 p.m. And we have assistance in almost every single language through a translator line. So if you stay on the call, you'll be able to get help in the language of your choice. So to think a little bit about what this process looks like for an individual. Let's say at some point in the next 12 months, let's say in August 1st, you are selected for renewal. We will first try to automatically process your renewal. And if we're able to, that is great. We will confirm you are still eligible for MassHealth, and we will just send you a notice in the mail that says, great, you are still eligible for MassHealth. You do not need to take further action. If we're not able to automatically renew you, though, we will send you that blue envelope in the mail. You will have 45 days, calendar days, to respond to that blue envelope. If you're in a long-term care facility, you have 30 days to respond. If you reply in those 45 days, most likely we will be able to determine whether or not you are eligible. In some cases, we may still need more information from you. In those scenarios, we will send you an RFI, a request for information, which will come in a white envelope. And members will have 90 days to submit the additional information needed for that RFI. At that time, we will determine whether, if you reply to that RFI, and we will use that additional information to determine whether or not you are eligible. If you are not eligible for MassHealth, either based on the information in your renewal or the RFI, then your coverage will end. And we will at that time send you a notice informing you that your coverage has ended. And members will have at least 14 days, 2 weeks, after receiving that termination notice before their health coverage ends. And I know Nikki will talk a little bit later about how individuals may transition to the connector in that time frame. It's also important to note that members who do not respond to their renewal will likely have their coverage ended. They will receive that same termination notice and have coverage for 14 days. At the time at which their coverage ends, because they did not respond, they will enter what we call the renewal reconsideration period. And this is a really important time, because what this means is if you didn't respond to your blue envelope and you lose your health coverage, you have an additional 90 days, about 3 months, to still contact MassHealth, complete your renewal, and assuming you're eligible, have your coverage reinstated and reinstated back to that date that you lost coverage. So even if you go to a doctor's office or another healthcare provider and are told that you've lost your MassHealth, it's really important that you still give us a call at our contact center to provide your updated information, because if you didn't respond to your renewal, there's still a good chance you may still be eligible and can have your coverage reinstated. We also have additional supports for our members. So we have put together a number of flyers and posters and social media that we are asking our state agency partners, providers in your communities, other nonprofits and organizations in the places you live to put up and share to make sure that folks know about this process. And those materials are available in 9 different languages. We also will have MassHealth ads that will be on local language TV and radio stations. And we also have community-based organizations, or CBOs, that we're partnering with that focus on supporting specific groups of individuals, such as immigrants and refugees. We will also be publishing video blogs that will incorporate American Sign Language, and the renewal forms themselves will be mailed in English or Spanish and are also available in large print or Braille. If you need support in another language, you can call our customer service center and receive free translation services in the language of your choice. The contact center that you'll call has representatives who speak English, Spanish, and Haitian Creole, but they also have access to a language line where an interpreter will join the call and be able to support you in the language of your choice. We'll also be publishing a list of CAC, or those certified application counselors in your community who speak different languages than English and are able to support you. We will also be hosting some enrollment events on site with translators that will be able to support you in person. For individuals who speak American Sign Language, MassHealth also offers on-demand VRI in person at the MassHealth enrollment centers. If you no longer qualify for MassHealth, there are still affordable health coverage options for you. First and foremost, there's the Massachusetts Health Connector, which Nikki will talk about in a little bit, a couple minutes. But for members who are over 65 years old, there are also other affordable options. Individuals who don't qualify for Medicare may still be eligible for connector coverage. Members who lost MassHealth because they lost their Social Security income may be able to reapply. If members aren't eligible for MassHealth, they may still qualify for the Medicare Savings Program, which is a federally funded program that enables folks to have support in paying some of their healthcare costs. Other programs that members may qualify for also include the Frail Elder Waiver, the Program of All-Inclusive Care for the Elderly, or PACE, and Prescription Advantage, and other programs that may be run through your Aging Services Access Point. One resource that can be helpful is the MassHealth Renewal Health Guide, and this has a lot of detailed information as well as frequently asked questions. So if there's something that I mentioned on the call today that you'd like to learn more about, this guide will likely have additional information that you can get support from. You switch to the next slide. You can also visit our MassHealth eligibility redeterminations website, which is mass.gov/masshealthrenew. This has a lot of great resources, as well as like the quickest way to get to the page that outlines how you can renew or how you can update your information as well. So this is kind of how I think about like a one-stop shop for any questions you might have about this process. And with that, the last few reminders I will leave you with before I hand it off to Nikki or the Connector team is if you are under 65, the fastest and hopefully easiest way to renew your coverage is online using your MA login account. If you are over 65 or in a nursing facility or home and community-based services waiver, you can use e-submission to submit your renewal online. Make sure to tell us if you move, change jobs or income, become pregnant, or have other changes in your household. I also will say we are working to do everything we can to make wait times at our customer service center short, but there may be longer wait times in the interim as we really get up to speed. And you may not get your renewal form right away. They'll be sent out across the next year. So some individuals will get them this month, some individuals will get them, let's say in November, and some folks won't get them until this upcoming March. And make sure there are a lot of resources available to support you on this. There's the MassHealth Customer Service Center you can call. There are MassHealth enrollment centers. And there's also resources in your communities that can also help you through this process. We are here to help you, and we want to make sure that you are able to keep the best health coverage that you qualify for. And with that, I will hand it off to Nikki, who will talk a little bit about connector coverage.
Thanks so much, Elizabeth. I'm going to talk about what the Health Connector is and how people who may not be qualifying for MassHealth anymore can access coverage. So for those of you who are not familiar with the Health Connector, I think I just want to take a moment to explain that we are the state's health insurance marketplace, and we're here to offer individuals, families, and small employers access to affordable health insurance coverage options. So if you don't know too much about us, you may be thinking, okay, who exactly gets their coverage from the Health Connector? And it's really people who don't have insurance through a job, maybe either their own position or a job, their partner or their spouse's employer-sponsored insurance. Now, a lot of people who apply for coverage through the Health Connector can get help paying for that health insurance. And, when we are talking to folks, we spend a lot of time talking about health insurance coverage, but we also want to acknowledge that folks can also buy dental insurance through the Health Connector. And lastly, not entirely relevant for this conversation, but just want folks to be aware, we also do offer coverage to small employers. So small employers with fewer than 50 full-time employees can choose to offer health and dental plans through our Health Connector for Business platform. So Elizabeth mentioned this a little bit, but I just want to explain something. Whether you're looking at health insurance coverage through the Health Connector because you no longer qualify for MassHealth coverage, or if you're looking for health insurance coverage through an employer now. So there is something known as special enrollment periods. So if you lose access to mass health coverage, it is considered a qualifying life event. And that is going to give you a special enrollment period to apply for or enroll in health insurance plans outside of our annual open enrollment period. So basically, a life event that would let somebody qualify to get into coverage are things like a change in household size, somebody's income going up or down, an update to immigration status, etc. And what I think is really important, the big key takeaway here is if somebody has a qualifying life event, it's really important that they report that information either to the Health Connector or to their own employer as soon as possible. Now, if someone is getting coverage through the Health Connector during the special enrollment period, all payment and enrollment deadlines still apply. But again, you just have a longer period of time to get into Health Connector coverage if you need it. Now, on this slide here, I'm going to take you through a little bit of health insurance speak, but really try to point you to the key points, things I want you to just take away. So any plan that you enroll in through the Health Connector meets state and federal coverage standards. So you never have to worry that if you enroll in a Health Connector plan, you never have to worry that you aren't going to get, comprehensive benefits, or that you might in fact be, you may have to pay a state tax penalty. Nothing like that. So every health insurance plan and every dental plan are known as qualified health plans or qualified dental plans. Now, we offer coverage through the leading carriers in Massachusetts. So we partner with most every leading carrier in Massachusetts, and depending on what type of health insurance coverage you qualify for and where you live, you're going to have a variety of options. Now, I'm going to talk to you about some savings that a person or their family could get, specifically and only if you come through the Health Connector. So we are able to offer savings to health plans with advanced premium tax credits. So basically what this does is these tax credits let people qualify for dollars that help them reduce the cost of their monthly premium. And then we have another program, this is very specific to Massachusetts, and it's called our Connector Care program. And this is for people who are in lower income ranges and meet other eligibility requirements. And essentially they can qualify for these low or no cost coverage options. And as I had said at the outset, this is all comprehensive, and the plans are meet all the state coverage standards. Now, in addition, we also offer catastrophic plans and dental plans. So I mentioned the dental plans already, but the catastrophic plans, I just want to acknowledge that these are plans that are lower monthly premiums. They're typically available to people who are under 30 years of age or with a hardship exemption. And these catastrophic plans, this is kind of where I like to do my buyer beware. These catastrophic plans, you would see a lower price tag on the monthly premium, but they're going to be a higher cost at point of service when somebody goes to use that coverage. So going on to the next slide, I really just want to talk about those two different ways in which somebody can get help paying for their coverage through the Health Connector. So I've already mentioned advanced premium tax credits, and I think I've said, it can lower the premium amount that someone pays each month. But the way it works is that the IRS sends the tax credit directly to the insurance company. So the person, as a consumer, you just pay less each month. And then you are, based on all the information you provide us in the application, if you in fact qualify for advanced premium tax credits, you can choose to apply some or all of those tax credits to your monthly premium payment. Now, with the Connector Care program, the way in which we're able to offer these plans, these comprehensive plans at such low, good rates, is because We're using a combination of federal advanced premium tax credits that you're eligible for, plus state funds, and that helps reduce the cost that you pay each month. Now, I keep mentioning that these plans are comprehensive, but what does that really mean for you? They're great plans. They have low monthly premiums, low out-of-pocket costs, and there are no deductibles. And depending on the plan type you qualify for, you could choose a plan as low as $0 to $134 a month. So you really do have some great options if you qualify for Connector Care. On to the next slide. And Elizabeth covered some of this about our online application. So she talked about different ways that you could update your application. And I think it's really important at this point to explain that the Health Connector and MassHealth use the same application at mahealthconnector.org. We also have a Spanish version of our website, and that is listed here. It's mahealthconnector.org/ES. You can also apply or update your application over the phone or with the help of a community organization. And Elizabeth mentioned this, we are using a lot of the same resources in the community to help someone find out if they qualify for coverage, help somebody renew or update their application. So again, maybe this is, a good time to acknowledge that because we're using the same online application for the Health Connector and MassHealth, you will get letters from the Health Connector and MassHealth telling you about next steps. So we just wanted to explain that relationship a little. On the next slide, you're seeing just a screenshot of what this looks like. So when you come to mahealthconnector.org, you would want to go to, I believe it says sign in individuals and families or apply now. It's a couple of different ways to get there, but this is the landing page for the online application. And if you have never been here before, you would go down to the bottom and you would choose create an account. However, if you already have an online account, you can go through and click sign in. If you haven't logged in a long time, you can, request to reset your password or, help you remember what your username is. I mean, this happens to people all the time. So if you get stuck, you have any issue just even getting into the application, you can call our customer service center and someone there can help you get into the application. Now, if you in fact go through this process and you find out, you're no longer qualified for MassHealth, you do need coverage through the Health Connector and you qualify for it, the next step you're going to take is shop for a plan. So we have a variety of tools on our website. You can enter some of your preferences. So you could enter the providers that you'd like. You can enter medication preferences. You can also, find an estimate about plans and pricing in your area. So if you want to do some comparison shopping before you actually complete an application, you can use our plan comparison tool. And if you want to look at pricing and see which health insurance carriers and which plans are available in your area and how much they cost, you can use our Get an Estimate tool. So in terms of getting help with this health insurance coverage process, again, just reinforcing what Elizabeth said, there is free enrollment assistance available through our customer service representatives for both of our organizations. But we also rely upon those people who are certified assisters through our community partner organizations. So on this slide here, you're seeing a telephone number for the Health Connector customer service line, and that's 877-623-6765. For TTY, it's 877-623-7773. Or if you're looking for information about hours of operation, the days in which our customer service is open, you can get that information from mahealthconnector.org's website. And if you are looking for one of these certified counselors, certified assisters, you can go to our website and you can search for someone that is close to you and also speaks the language. Perhaps if you need assistance in a language other than English, you can find that help from our website. On to the next slide. Just a couple of key takeaways for you. So if you are new to the Health Connector and you're not sure exactly who we are, just keep in the back of your mind that we're here to offer coverage for individuals, families, and small employers in Massachusetts that don't have access to affordable ESI. If someone has lost access to MassHealth coverage and you still need health or dental insurance, you can enroll through the Massachusetts Health Connector and find out what you're eligible for. And in particular, if someone had applied before and their income may have been too high in the past to qualify, know that there are more and new savings available for Massachusetts residents. And as I just mentioned, we do have a get an estimate tool, so you can get a sense of what health insurance plans are available near you, what they cost, even before you complete a full application. On the next slide, just a couple of more thoughts here about deadlines. Now, Elizabeth talked a lot about what the dates were or the deadlines were for those who are going through the MassHealth renewals process. If you in fact find out that you no longer qualify for MassHealth coverage and you need health insurance coverage through the Health Connector, we just encourage you to act as soon as possible. But you need to apply, you need to shop, you need to enroll and pay your first monthly premium if you owe one by the 23rd of the month. And that's so that your coverage can start on the 1st of the following month. So as an example here, you want to take all this action by April 23rd if you were looking for coverage to start on May 1st. When you were in the application, you also technically have the ability to start the coverage on the second month after you enroll. Again, you can apply for coverage online on your own, over the phone, or with the help of a community partner organization. And again, there is lots of free help available for you. So if you want some assistance, really, we just encourage you to reach out today, make an appointment, and someone will be there to help you. So Erin, I think we're ready for some questions.
Okay, excellent. And we have a lot that are coming through. So thank you so much, everyone. Please continue to ask your questions in the Q&A box down at the bottom of the screen. I've gotten a few questions just about distribution of the slides and if this is being recorded. So I'll just quickly note that we will be sharing the slides via email afterwards, and this is being recorded and it will be posted to the Health Connectors video library. So you can come back and reference it or share it with friends, family members, whomever might benefit. So one of the questions that we received was, if an individual has changed their job or they're now getting insurance through their employer, but it's too expensive, can they sign up through MassHealth or the Health Connector? What are the rules there?
So we can actually take this question a couple of different ways. So I think first we might want to start with the concept of affordability. So if someone has an offer of employer-sponsored insurance, technically you or your family wouldn't be able to access coverage through the Health Connector. However, if that coverage that is offered to you is actually considered unaffordable by state standards, meaning it's too much money for you at your income level, et cetera, you could in fact get coverage through the Health Connector and get help paying for that. Now, the process for this, I think this is really important, and Erin, perhaps you could put the link into the worksheet in the chat, but there is some information that someone would need to collect from their employer's HR department. So you're going to want to get information about the plan, how much the employer is going to contribute to that plan, how much is expected of you to contribute, like how much you and your family would need to contribute. And then if you enter all of this information, you can basically do a calculation on this worksheet. But honestly, I recommend letting the system do the calculation. And if we find that, you know, it is not considered affordable, the coverage is not, you could in fact get coverage through the Health Connector.
Oh, Elizabeth, I think you might be muted on your, two call-in lines.
I am. I'm so worried about making noise when I am not trying to talk. Sorry about that, folks. On the MassHealth side, there are situations in which individuals have like employer insurance or commercial insurance and have MassHealth as like a third-party insurance for scenarios in which the commercial insurance does not cover. It's a little bit more of a nuanced issue, but certainly something that you should reach out to our contact center with any questions.
Great, thank you. And this question, I'll start off by going over to Elizabeth with, and it's just with respect to individuals who need to respond or contact MassHealth who might have certain circumstances that make it particularly difficult to reach out. Maybe they're in a nursing facility or don't have, you know, regular access to a phone or computer. How should they proceed?
Yeah, it's a great question. We are working a lot to make sure that members have different options to submit their renewal that works for them. So for instance, some individuals might not be comfortable using an online application, and they can submit their renewal on paper, or they can do so over the phone at our contact center. They can also get help from a certified application counselor in their community, maybe someone they have a trusted relationship with, or they can schedule an appointment at a MassHealth enrollment center. And that can either be like walking in to get support, or it could be scheduling an appointment for virtual or over the phone support. Members who are maybe in like a nursing facility or who they themselves are not necessarily able to complete the application, they're able to fill out an authorized designated representative form, which would authorize another individual, whether a family member or a close friend, to complete that form on their behalf. So there are certainly options for individuals who don't feel like they themselves will be able to submit the renewal on their own.
Great, thank you so much. So going back to applying and maybe using the online portal or completing, paper application, when you select a head of household, if married, does it matter which individual you put as the head of household? Should you be strategic in this decision?
Yeah, so the head of household, as designated on the form, will be the ones who will be able to make updates to the account, such as like changing your address or other changes about your family. So I would think about who maybe typically is the person who handles those responsibilities and try to designate that person as the head of household.
Great. So now when the renewal process is, in the midst of the renewal process, if MassHealth has data for an individual and it ends up giving them a non-MassHealth determination, is there still a need to respond even though they might be found eligible for maybe a plan through the Health Connector? Do they have to take action if MassHealth has data that suggests they might be eligible for something else?
Members should always take action to make sure we have the most up-to-date information. Even if you're not eligible for MassHealth, if you respond to your renewal with your most up-to-date information, we will share that as part of the standard process with the Health Connector. And then the Health Connector will be able to use that information to determine the benefit that you qualify for. So oftentimes, and Nikki, please keep me honest here, if you share your updated information, it gives you a better chance of being identified up front for a subsidized plan. Whereas if you don't share your information back, I think you're defaulted until you share that information to a different plan at the Health Connector. I don't know if you'd add anything more nuanced on that, Nikki.
No, nothing additional from this side. I think, again, it's just, as I think we've been saying, it's just really important to, if you can get comfortable with your own online application and comfortable with the idea of, updating it. Or if you don't feel comfortable yourself going into it, contacting our customer service, one of our customer service representatives, and just ensuring that the information that we have within that application is the most up to date for you.
Great. And Nikki, if somebody becomes eligible for the Health Connector, do you just want to touch upon what might be different for them? I know you mentioned it in the presentation, but the need to take action and make that payment by a certain date, just a reminder.
Yeah, absolutely. That's really helpful. We're here today, we're presenting together, but we've acknowledged that these are two different organizations, MassHealth and the Health Connector. So our programs are different, our operations are different. So if in fact you qualify for a Health Connector plan and you're required to pay a monthly premium now, what you're going to see, you'll be in the application. It's going to tell you whenever you're done completing the application, it is going to tell you exactly what it is that you qualify for, like what type of Health Connector coverage. Perhaps you qualify for Connector Care, or perhaps you qualify for a Health Connector plan, not necessarily Connector Care, but you still have federal tax credits. So you'll need to choose the plan that you want to enroll in. We've got some tools that you can use to help you make that decision, or you can get help making that decision. Then you select the plan, you complete the enrollment process online. You need to pay. We need to do all that before the 23rd of each month. Pay your premium before the 23rd, and then your plan will be effective on the 1st of the following month. So I apologize if I repeated a lot of stuff, but I guess I just want to drive home that there are different processes, and the deadlines are real, and we really want to make sure people don't have any gaps in coverage.
Great, thank you so much. And with respect to getting assistance in specific communities or specific languages, can you both just review quickly kind of the best route for somebody to find in community supports in their town or in a specific language?
Yeah, of course. So actually, if I can share my screen right now, I can quickly show folks what it looks like to look for a navigator or a connector online. Obviously, understand this solution will not be for everyone, and we'll talk through some of the other options. But you will be brought to this page, which will allow you to search for a location. So let's say you live in Boston. You can select Boston, the second column, hit the search button, and then as you scroll down, this page will refresh, assuming my Wi-Fi decides to work today. Always a bit of a question. Well, so this did not refresh the page because we've been having Wi-Fi issues, but as you can see, I previously had searched in Waltham, and it showed a CAC organization, a certified application counselor in the community, along with their address and phone number, where a member would be able to get support in that area. So that is one great option. You also can reach out to, if you are an older adult, like an aging service access point or an ASAP in your community, or a council on aging who can help direct you to resources. We also are working closely with providers and health plans to make sure that folks have the information, if not to help you themselves, then to direct you to someone who can help. You also can always call the contact center if you have questions, and they're able to help make sure you get the information you need.
And I don't have anything else to add. I mean, it is exactly the same on the Health Connector side, and know that we share the same. If you're under 65 years of age, we share the same certified application counselors and navigators. So it doesn't matter if you go to a CAC or you go to a navigator, they'll be able to help you with either MassHealth or Health Connector coverage. They're trained on both sets of coverage options for people.
Excellent, thank you. And this question is for Elizabeth. If somebody has completed the renewal process prior to April 1st, should they expect to have their eligibility already changed, or what will that process look like for somebody who might have recently completed it, but prior to April 1st?
That's a great question. So prior to April 1st, if you completed your renewal, we still had those COVID-related coverage protections in place. So there may be situations in which you completed your renewal and thought your coverage would change if you completed it prior to April 1st, but you found that your coverage did not change. And that's because we had those federal protections in place that meant that we kept members' coverage the same leading up and until this past April 1st. Now you will be selected for renewal. Every single person with MassHealth will be selected for renewal over the next year. At that time, when you complete your renewal form, your eligibility for MassHealth may change if your circumstances have changed. So starting with anyone who submits their renewal form after April 1st, continuing through this entire next year when everyone will receive a renewal form, when you submit updated information, your coverage will change if you're no longer eligible. But if you are still eligible and return that form, you will maintain your MassHealth.
Great. And can you just talk a little bit about the process that a person has when they receive the blue envelope and how much time they have? I know there are concerns about potentially an April 23rd deadline, but this isn't all happening immediately. If you can just elaborate.
That's exactly right. So we will be selecting members for their renewal every single month throughout this next year. And when we select a member for renewal, we will first try to automatically renew them. If we're not able to automatically renew them, we will send them this big blue envelope in the mail. When an individual receives that blue envelope in the mail, they will have 45 days to respond. And in those 45 days, they can reach out to a certified application counselor for support. They can set up an appointment at a MassHealth enrollment center. They can call the contact center, but they will have those full 45 days to respond and return that information to us.
Great. And now this question, Nikki, for somebody who has insurance through the connector, but they are finding it unaffordable, what are some options that they might have to reduce their monthly premium amount?
That's a great question. So if someone is either finds that they're eligible for connector care, or they are currently a Health Connector connector care member, I think this is just good general information. We do have a hardship waiver program where somebody could just, provide us with some additional details about what is currently going on, what their situation is. Maybe there has been some extreme illness or something that has been that just occurred or has been happening that has really changed somebody's situation, somebody's financial situation. So there are waivers that can help somebody pay or reduce the cost of what they would owe. So again, this is really helpful for people if you find that you no longer qualify for MassHealth for whatever reason, and you do in fact qualify for connector care, but there's something else going on that isn't exactly captured within this online application. And I think we can put a link to that information in the chat stream too, or wherever Erin wants to put it.
Yes, I haven't been updating the chat because I was sharing my screen, so I wasn't able to, but I can start doing that now as well. So another question that we do have, is somebody able to decline coverage through MassHealth and select coverage through the Health Connector? And this is specifically related to concerns with estate recovery. There were a few questions actually more generally about estate recovery. So I'm not sure if that's something we can answer here or if it's very specific, but just wanted to at least put that out there for the time being.
I think that's one probably better taken offline. Sorry, Erin.
No, not a problem at all. And for any questions that we don't get to in the email along with the presentation, we're going to share all of the links that we went through today, as well as any questions that we do need to take back and consult with colleagues on. We want to make sure that we are providing the accurate information to all of you. And so we will provide it in an email as well for future reference too.
Erin, can I answer one question I saw in the chat? Sorry to jump in. I saw a question from somebody who received a letter, like a green letter, I think, from MassHealth that informed them they have a new health plan. And they're wondering, why do they have to renew again if they just confirmed they have a health plan? And I wanted to clarify this because this is a little confusing, definitely. It's really important. So a lot of our members recently either received confirmation that they will be on the same health plan, or were told that their doctor moved to a different health plan. And this is part of us launching new contracts with a lot of our health plans. This is separate from the MassHealth renewal process. So if you received that green letter, that's good. Make sure you read it and respond if needed. But that letter was really about which health plan you were on, not about whether or not you were eligible for MassHealth. Those individuals who received that green letter about their health plan will still receive at some point in this next year a blue envelope asking them to share updated information about their income, their household, to determine whether or not they are still qualified to receive MassHealth coverage. So just wanted to share that. I know it's definitely a little confusing.
Great, thank you for that. And for people who want to cancel current MassHealth coverage, maybe circumstances have changed and they want to proactively remove themselves from coverage, how should they go about that?
Yeah, they can call the MassHealth Contact Center if they would like to voluntarily withdraw from MassHealth coverage.
Great, thank you. Okay. And as far as languages, I know that you did show the same website for getting assistance in Waltham. And is the entire list of languages for getting in community support available, or are there additional languages that may be available in a different way?
Yeah, I think we're still working on finalizing that list. We have a lot of organizations who are interested in becoming certified application counselors. So we are just making sure we have the most updated information before we have that online, I believe.
And that's great. And maybe you just mentioned something where there was a question. I thought it might be best addressed in an email, but if somebody is interested in becoming an organization or an individual certified application counselor, what would those steps be?
Yeah, that's a great question. We would love more organizations to become certified application counselors. You should reach out to MassHealth with an email address that I'm trying to pull up, but if I'm not able to pull up in time, then I will make sure Erin includes in her follow-up. But if you reach out to us, we can talk about what it means to be a certified application counselor and connect you with the training that the individual at your organization would go through to make sure they have the information they need to be a certified application counselor.
Great, thank you. And Nikki, just coming back to having access to employer coverage. If somebody has access to employer coverage, that doesn't necessarily mean they can't get coverage through the Health Connector. But again, they want to make sure that it would not be considered affordable by your definition, correct?
Right. So just to confirm, so the general rule is if you have access to ESI, you're not going to be able to get help paying for coverage through the Health Connector. However, the nuance there is it's what is considered affordable. So if you're looking at the cost of what this coverage it would mean for you, your contribution in comparison to your income, let's say, you can in fact provide the application with all the information from your employer about that coverage. And if it is considered unaffordable from using the state and federal standards, then you could in fact get coverage through the Health Connector and potentially get some help paying for that coverage as well.
Great.
I know I'm making it sounds more complicated than it is, but basically you just need to go to your employer, get some information, and then put it back into the application. So we don't want to discourage anyone from doing that at all. And again, you can get some help with that with customer service, or a certified assistant can help you with this process, because they do it all the time.
And I was able to just put that affordability calculator link in the chat as well.
Okay, great.
And I think we have time for one more question. Elizabeth, could you just review, I think you had mentioned that 90-day kind of process. If you could review that before we wrap up.
Definitely. So in that 90-day process, so when you receive your termination notice, you will have 14 days of coverage. After that 14th day, you will no longer have MassHealth coverage. So if you go to a doctor or you try to get like a prescription picked up, you will not have health insurance. But within those 90 days, at any point, you can reach out to MassHealth and complete that renewal. If you complete that renewal and are still qualified for MassHealth, we will reinstate your coverage at that time and reinstate it back to the date that you lost coverage. So then you'll be able to make sure that you have that insurance to go to a provider or to pick up a prescription. So it's not that it's like 90 days in which you like don't have coverage. It's 90 days where you have the opportunity to just raise your hand and get your MassHealth coverage reinstated. After those 90 days, you would not be able to just like raise your hand and complete your renewal. You'd have to apply all over again to MassHealth. So that's why those 3 months are really important. If you notice you've lost MassHealth coverage, to pick up the phone, give us a call, and see if we can reinstate your coverage.
Thank you so much. And if somebody during that 90-day window does go to pick up a prescription, if they have to pay out of pocket, or, how will that work for an individual's experience?
Sorry, could you repeat that one, Erin? I'm sorry.
No, not a problem. Sorry. If somebody were to go and access services, not recognizing that maybe they didn't have coverage and needed those services, and then would they be reimbursed for anything they might have paid out of pocket, or does that depend on specific circumstances?
Let me take that one back. But I would say the best thing you can do is just call MassHealth and try to see if you're eligible for coverage, and we will do everything we can to make that as smooth as possible.
Great, thank you so much. Well, Elizabeth, Nikki, thank you so much for presenting today. To everyone who joined, thank you so much for engaging us with your questions. Thank you so much for attending just to learn this information. Again, we will send the presentation, we'll send a link to the recording, as well as those links that are helpful as you go through this experience. Again, please feel free to share those with family, friends, anyone else you know who's going through the redetermination process. Nikki, Elizabeth, anything you want to leave folks with?
Nope, just
thank you all so much. Look out for the blue envelope. Appreciate your time.
Great. Thanks, everyone. Stay safe.